Welcome to the overview of the Pathways Project. We hope this summary can give you an idea of how the Pathways Project can help you improve the care of your dialysis patients. During this presentation, we will cover the following. Why is the Pathways Project needed? What is provided to the site by the Pathways team? What the project is, and what each participating site will actually do during the duration of the project. First, the why. Why is the Pathways Project needed? In the United States, there are more seriously ill patients with poor outcomes who are started on dialysis compared to other countries. These patients have a high symptom burden, high hospitalization rate, and unwanted high-intensity care at the end of life. There's limited access to advanced care planning and shared decision-making, and the end-of-life experience for these patients is often rated by their families as worse than those patients with cancer or other chronic conditions. We hope that we can help improve the care for your seriously ill patients, decrease hospitalizations, and respect their wishes. This current model of care is hard on the patients, hard on families, but perhaps even harder cumulatively on your dialysis center staff. So how will Pathways help create this change? First, we hope to help identify seriously ill patients using the surprise question, which is, would you be surprised if this patient died within the next 6 months? And then we want to help establish a pathway for care that can allow for a less aggressive care plan as the patient desires. This would include options such as shared decision making, proactive planning for palliative dialysis when it gets to that point, withdraw from dialysis, and transition to hospice when appropriate for the patient. There are additional but optional best practices that are detailed in the Pathways Change package that we can help you utilize if you desire. How will the Pathways Project help address this problem? This graphic shows the various pathways that a patient can consider as they travel through end-stage renal disease. These interventions are detailed further in the Change package. These practices involve patient-centered and individualized care, a collaborative approach, and evidence-based practices that can impact the care of patients. When we combine these best practices together, we can transform the care for patients with end-stage renal disease. So how will the Pathways team help you with this transformation? We'll provide training for your team on the communication skills that they can apply to their current conversations that they're already having with patients. We'll have a great website with tools and resources to implement supportive care practices. You'll have support from the Pathways faculty team as well as our quality improvement advisor that will help you make actionable changes in your current workflow to produce more patient-centered care. We'll also have monthly benchmarking reports to compare how you are doing with the other project sites. There'll be a fun level of excitement with the sharing and receiving of these solutions, as well as the encouragement from the other teams who are engaged in the same effort, which will lead to this pride in being a national innovator as we change how patients with end-stage renal disease are being treated. What will this project require you to do at your site? First, select a change team of 3 to 5 people. This team will consist of a champion or two. This could be a nephrologist, nurse practitioner, or social worker who can help lead the change. Other members could include your day-to-day leaders, a lead nurse, nurse practitioner, social worker, and other possible team members such as administrators, patient care techs, patient representatives, or collaborators from the nephrology practice and palliative care clinics that you work with on a daily basis. Additionally, your change team will attend 3 learning sessions, with all expenses paid for up to the 5 team members. These sessions will occur in the spring of 19, the fall of 2019, and the spring of 2020, and they last about 2 days, including the travel time to get to the location. In between the learning sessions, we'll call the action periods. This is where you will implement the 3 best practices, as well as have the opportunity to listen to monthly webinars to guide the process. You'll also participate in monthly progress reports. We'll do a baseline and follow-up survey of the staff that are working at your center, and these surveys should take no more than 10 minutes per staff member. We'll do a chart audit at the beginning for the baseline as well as at the follow-up for your center, looking at those patients on your caseload who are seriously ill, and these chart audits should take no more than 5 to 10 minutes per chart. Monthly, you'll identify the census of your seriously ill patients during rounding. And then you'll refer those seriously ill patients who agree to participate in the Pathways project to the Pathways team. The Pathways team will then obtain consent and conduct interviews by phone. If you have more questions and want to get more information, please contact our Pathways team. Our senior faculty is listed here, and our administrative staff is listed below as well. Thank you so much, and we look forward to working with you. Thank you.